All right, hello everyone, and good morning. Welcome to the PT on Ice Daily Show, Fitness Athlete Friday edition. I hope that you are all doing well and staying safe in this global pandemic. My name is Kelsey Valentine, and I am one of two faculty for clinical management of the fitness athlete pregnancy and postpartum. And I'm also a pelvic floor physiotherapist. So this is going to be a bit of a pelvic health take on Fitness Athlete Friday and how you can help some of your women patients maintain some of their fitness goals. So what I'm going to be talking about today is pessaries. And before I get into that, I wanted to let all of you know that there is still some space in our upcoming cohort of clinical management of the fitness athlete pregnancy and postpartum, which starts on May 18th. So that's this Monday. I know a lot of you have been either rerouting some of your courses to online as some live courses are still canceled, or maybe you're bored at home and looking to learn some more before you head back to work. So if you're interested in joining us and you work with women of any kind, you'll love this course. You can head over to ptonice.com and go to online courses to sign up. Yeah, so let's talk about pessaries. So I'm imagining that a lot of you aren't all that familiar with them, or if you don't work with women, then it might not be something that you're super comfortable with. So I wanted to kind of generally explain what they are and what they're used for, some of the benefits, and then some of the research that's going on around pessaries. So generally speaking, a pessary is a medical grade silicone insert that you can insert into your vaginal opening or your vagina canal. And it's most commonly used conservatively or as a non-surgical option for the treatment of both pelvic organ prolapse and stress urinary incontinence. So before I kind of get too deep into pessaries, I want to make sure that everyone has a good background of what pelvic organ prolapse and stress incontinence is. So pelvic organ prolapse is the descent of one or more of your pelvic organs towards or beyond your vaginal opening. So this could be your bladder, which is the most common one that we see, and we call that a cystocele. But it could also be your rectum, your uterus, or your intestines. And prolapse can range in severity. So there's a Baden-Walker scale which grades the different severity of prolapse. So a grade 0 would be no pelvic organ descent. So for example, your bladder hasn't moved downwards at all. A grade 1 may still be considered within that normal range. Very common to have this. And it's more than 1 centimeter above the level of what we call the hymen, which is around the vaginal opening area. A grade 2 prolapse is within 1 centimeter above or below the hymen. And a grade 3 prolapse is 1 to 2 centimeters below, somewhere in that range. And a grade 4 is more than 2 centimeters below the hymen. So there's a big range in the severity that people can present with a prolapse. And what we know now is that our symptoms don't always correlate to the amount of severity. So like many other things that we see in the physio world, someone can have very severe tissue damage or a very severe prolapse and not be symptomatic at all, whereas other people might only have a grade 1 to 2 prolapse, so more mild, and can be very symptomatic and very aware of their symptoms. So there are a lot of things that can make someone more likely to develop pelvic organ prolapse, but we don't really know what causes it. So some of the risk factors that we are aware of would be older age, number of births, so the more vaginal births that you've had, If you've had a forceps delivery or a vacuum assist delivery, so any sort of assisted vaginal delivery, can make you more likely. A levator ani avulsion tear can make you more likely to have prolapse. Obesity is considered a risk factor, constipation is, and chronic cough. And the reason is that extra straining on our pelvic floor can put us at higher risk. People with connective tissue disorders are more likely to develop prolapse, we think. Estrogen deficiencies, hysterectomy is a risk factor. So if you have had your uterus removed, then you're more likely to see pelvic organ descent from some of your other pelvic organs. And then chronic heavy lifting occupations. So this one is interesting because although we know that chronic heavy lifting occupations is considered a risk factor, we actually don't have direct evidence that shows that higher impact or more strenuous exercise is a risk factor. So that's something that's still kind of being worked out in the literature. So we don't know that for sure, but we do know that heavy occupational lifting is. So that's defined as either heavy lifting more than 20 times a week, or working in a standing position more than 50% of the time, which is actually a lot of SPTs, or self-reported physically heavy work. So it has to be at least 2 of those 3 options in order to be defined as chronic heavy lifting occupations. And then just so you're aware, if your client may or may not be presenting with some symptoms of prolapse, some of the symptoms that they might describe if they do have a pelvic organ prolapse would be they might feel a heaviness in their pelvic floor, or they might describe it as almost feeling swollen or like this dragging bulge sensation. They might describe it as feeling like a tampon is falling out. They might visually see a bulge or a protrusion, or they might be able to feel one. They might have discomfort with intercourse. They might need to strain or have difficulty emptying either their bowels or their bladder. So those are some common things that people might describe. It's not an exhaustive list, but if they have prolapse, they might describe one or more of those symptoms. So a pessary can help to manage a lot of those symptoms because it will provide support to the vaginal walls. So if you remember, it's a silicone insert, and it will give a little extra support to those vaginal walls to prevent some of that pelvic organ descent. And then I mentioned that another thing that pessaries can help out with is urinary incontinence, specifically stress urinary incontinence. So stress incontinence isn't a symptom of prolapse, but often the two go hand in hand. And for those of you who don't know, stress incontinence is the involuntary loss of urine, and that can either be with increased intra-abdominal pressure or with effort or physical insertion. So that would include things like sneezing, coughing, laughing really hard, running, jumping, any sort of transitional movement. So perhaps in the older adult, especially getting up out of bed, something like that. I hear it a lot with vomiting. So in my pregnant clients, when they have morning sickness, they say vomiting is the time that they notice it the most. So usually it's just on that extra stress on the pelvic floor. And so a pessary would help to manage some of those stress urinary incontinence symptoms because it will compress the urethra. So there are a lot of different types of pessaries that your patient could use or be fit with, and not every type will work the same for every person. So some are shaped more like a circle or a disc shape. Some are shaped more like a cube. Some are more like a lever. So there's a variety of different ones that a woman could be fit with, and some are going to be more comfortable for them than others. And almost anyone can be fit with a pessary. Typically, it would be a gynecologist or a urogynecologist that would fit them for your client. but some pelvic floor PTs will go through some additional training in order to be able to fit their clients with pessaries. And these can be worn either kind of indefinitely, but would be removed for things like cleaning them weekly, or for intercourse in some cases. And some people will only opt to just kind of insert them for the task that they need it for. So this can be especially of interest to our athletes doing a lot of heavy lifting or running, who only experience their symptoms during those things. It can provide a little extra support to those pelvic organs during those times. So generally, what we know is that they're considered to be an effective conservative treatment for prolapse and for stress incontinence, and they're relatively well tolerated by most women. So what we know is that about 70 to 92% of women are considered satisfied with their vaginal pessary. But many of us question whether their use is considered more of a passive support, comparable to like an ankle brace with an ankle sprain, and that the pelvic floor muscles will weaken and create reliance on a pessary. And so as the ICE community, I think a lot of us are kind of on the same page, and a lot of us believe that we tend to choose active options, and the active approach is typically the best approach. And I definitely agree with this. I know based on strong research that having a strong pelvic floor to support the pelvic organs can be super helpful for prolapse in terms of both symptoms and potentially even reducing the grade of prolapse, and also really effective for stress urinary incontinence. So I'm totally on board with having a good strong pelvic floor and teaching my clients how to use it properly. However, I want to play a little bit of devil's advocate here and bring to your attention some evidence that suggests that a pessary might provide benefit in addition to pelvic floor muscle training. So although we know that a pessary can provide some passive support, a lot of people just think that it's like that back brace or an abdominal binder, and it's just going to cause people to weaken their pelvic floor. But a pessary doesn't really show to have any influence on our pelvic floor muscles. So I'm curious to see other people's opinions, but from what we know, it doesn't necessarily apply in this case. It's not necessarily a good analogy to use for our clients, and it could prevent them from taking advantage of the benefits that a pessary can offer them. So I wanted to bring your attention, like I said, to some evidence about pessaries and how they might actually be really beneficial for our clients. So the first piece of evidence that I have here was a randomized controlled trial. And it was published in 2016 by Chung and colleagues that compared two groups. So it was looking at women with symptomatic prolapse between stages 1 and 3. And these women were randomized into two groups, one being pelvic floor muscle training alone, and the second group was pelvic floor muscle training and using a vaginal pessary. And they found a statistically greater improvement in the pessary group over that control group that just did the pelvic floor muscle training. So good quality evidence, a randomized controlled trial showing that the pessary on top of the pelvic floor training was actually more beneficial than pelvic floor training alone. Another study that was also published in 2016 found that in older women with symptomatic prolapse, there was no significant difference between the pessary treatment group and the pelvic floor muscle training group in reducing symptoms. But specific prolapse related symptoms did improve more with the pessary group than the pelvic floor muscle training group. So this study actually is showing that the pessary group alone was better than the pelvic floor muscle training group. A third piece of evidence that I wanted to bring to your attention was more based on subjective findings. So this one was looking at the bothersome symptoms that people experience with prolapse. They looked at quality of life and they looked at body image. And they found that those who were using pessaries had fewer bothersome symptoms. They reported an improved quality of life, and they reported improved body image when using a pessary. So that's another great study that kind of looks at the other side of things in terms of women's perceptions and feelings around them. And one last study even went as far to suggest that pessaries might actually prevent the progression of pelvic organ prolapse. So this one, the quality of the research wasn't quite as high, so take that with a grain of salt, but there's definitely a lot more that we can look at with pelvic organ prolapse and pessaries, and more research definitely needs to be done in this area, but definitely something that I find really fascinating. So there you have it. That's kind of a quick glimpse into some of the literature on the use of pessaries. Personally, as a PT, I'm going to try and find any way that I can to allow my patient to continue to exercise in the capacity that they would like to, if they have prolapse or stress urinary incontinence. So particularly my clients that are doing all the right things, they're coming to see me for pelvic floor training. They're learning how to brace appropriately with exercise. They're learning how to breathe through exercise. They have good control over their pelvic floor. They know how to use it appropriately. But their desire is to perform really high intensity exercise or high impact exercise, and they just can't do that without symptoms. I think this is an incredible option for them. And the evidence even backs it up to show that this is something that they can use to be able to continue to do the sport that they want to in the capacity and intensity that they want to, and keep people moving and healthy despite this, and to prevent surgery and some more invasive treatments. So I really like them as an option. I think they're a really compelling option. I'm curious to hear what other people have to say about the whole comparison to an ankle brace. Personally, I don't really think it's a fair comparison, but I'd love to hear a little debate back and forth on this chat, or we could chat about it after. So that's kind of all I have about pessaries for today. I want to thank you guys so much for listening, and if you have any questions at all, feel free to shoot me a message on here, or I'm also on Instagram at Kelsey Valentine PT. And remember that there are still a few more spaces available with our upcoming cohort of clinical management of the fitness athlete, pregnancy, and postpartum. So we hope to see you guys there, and thank you so much for listening. Have a great weekend.
Hey, thanks for tuning in to the PT on Ice Daily Show. If you enjoyed this content, head on over to iTunes and leave us a review, and be sure to check us out on Facebook and Instagram at the Institute of Clinical Excellence. If you're interested in getting plugged into more ICE content on a weekly basis while earning CEUs from home, check out our virtual ICE online mentorship program at ptonice.com. While you're there, sign up for our Hump Day Hustling newsletter for a free email every Wednesday morning with our top 5 research articles and social media posts that we think are worth reading. Head over to ptonice.com and scroll to the bottom of the page to sign up.